A pandemic is defined as an epidemic of disease that occurs over a widespread area and usually affects a sizable part of the population. With COVID still around, are we really in the clear? We've come a long way since 2020 and the early days of COVID-19. Masks, hand sanitizers, and closed restaurants or outdoor seating only. We're finally back to the way things used to be. Ohio reported 20,500 new COVID cases as of last Thursday, a third straight week of declining cases, but a slight increase in hospitalizations. So, is the pandemic over?
Well, it really depends on who you ask, to be honest.
Dr. Joe Gastaldo, an infectious disease specialist with Ohio Health.
I think it's a much different conversation today than it was when this virus first came on the scene in earlier 2020. We have vaccines that are still performing well against protecting against hospitalizations and death. We have home testing. We have outpatient treatments that also keep people out of the hospital and prevention from dying.
He says even though numbers are down, patients are still being hospitalized with COVID.
First are those with weakened immune systems. Second are those who are very frail, for example, those with advanced lung or heart disease. And then finally, the third category are those above the age of 70 who are not up to date on their vaccines. That's very different than where we were a year ago or even this past winter.
He says moving forward, he hopes the virus becomes even less disruptive in our day-to-day lives. The CDC has eased up on COVID-19 restrictions, such as shortening the quarantine time from 10 days to 5, but it has not publicly said the pandemic is over. I'm Terry Sullivan reporting.